Um, okay, quick question. Yeah, if let's say, for instance, the doctor would like to refer the client to physical therapy,
Mhm.
she's having swelling of the foot, or he needs her to go to the high risk clinic, the specialist clinic. Um, where would you go in for that one?
Well, I think it would start with orders.
Orders.
Yeah, and
And
you'd
this
want
will be
to
at the
learn.
end of
Mhm.
the end of the
And,
charting.
yeah, and then he would do a referral.
Okay.
So orders, referrals, and when you click on that, it's going to actually take you to this template right here.
Mhm.
Okay,
Okay.
then you would just
Referral template.
indicate, yeah, specialty name, is it obstetrics, whatever it's going to be. So we'll just say, we'll start with the physical therapy. So from the database pick list here, we would find PT, physical therapy. And if he has a specific provider that he wants the patient to see, when you click in here, you'll get the database pick list of all your providers. And remember,
Okay.
this is a filtered list, so if you need Dr. Smith, type SMITH on your keyboard, and it's going to filter your list. I can't believe you don't have a Dr. Smith on there. Everybody has a Dr. Smith.
Dr. Smith. I know.
Isn't that funny? Let me try just SM. Let's see, SM. Wow, I'm shocked. Okay, well, we'll say we're going to send it over to Ama.
Yes.
And then from the list of assessments, when you click in the field here, this is going to give you your patient's current assessment. Okay? If you need to add a new one in, they'll have to reach out to the add or update. Maybe she's having a little sciatica or, whatever the case may be. You would have to, again, go look for it and then add it in. So you, So let's see. Let me just put in, I'm going to say contain sciatica is SCI. Let me see if I can, or is it A search? Let's see. Yeah, see how this can be like, make you crazy?
All mixed in.
I'm trying to find, all right, injury to the sciatic nerve works for me. All right, so I'll select that one. So I'm adding that in as a new one. Now when I get to the referral here again, there it is right there. So I could just highlight it there, puts it into the grid, evaluate and treat, reason for the referral. This is a pick list, but you can just grab the free text line.
Empty line and typing.
Yeah, and then free text. This would be just for any additional comments or clinical information that the doctor would want to add. All right. Did we educate the patient? All right. This down here, this attachment, number one, you have to have the document generated first. But if I wanted to attach, and this would be a little tricky for an OB patient because we don't, unless he charted it on the encounter detail button. When I go to details, it's going to look for documents generated in the patient's chart. Yeah, and it's going to look at everything that's in here, and like there's my lab rec, my gin master. So it's whichever one and you don't have to do it. You don't have to attach anything. But the last step you want to do here is make sure you add this referral in because it's an order. Okay, then you could come back up again and do a second one. Maybe she's going to a high-risk doctor for her, prenatal care. A little additional information here. Okay, gravid imperative stuff that's going to be all included in there. And then again, you would indicate why, go through the same steps, and you add it. So this would be, we'll just say this is, high-risk pregnancy here. Okay, come on, fire in there. And then any other, for evaluation and treatment, or assumed care, rather. Okay, reason for referral, high-risk pregnancy, document, and then make sure you add it. Okay, so you have those two orders in there. Did not like them. Come on, add. Wow, why are you being so difficult? I said, obstetrics, providers, names. Maybe I didn't like it because I didn't put everything in there. Or to assume care. Everything's good. Instructions given. It's just not playing nice with us. You can put in.
It at the bottom, though. It did add it at the bottom.
Okay, there we go. All right, then save and close. So again, this is an order. So one thing we haven't talked about yet, again, really in detail, outside, before I go anywhere else, what other questions do you have? And you can think about these overnight. We can talk about them tomorrow too.
Okay.
All right. So if you're getting a little fuzzy now because you have a lot today. Gee, I can't imagine why. All right. But in order management again, we can print requisitions, but there's also the checkout. I'm sure Leanne touched on that during your core group training. But again, any orders that are done, after the doctor sees the patient, usually the nurse goes back in and does the follow-up, here's your prescription for prenatal vitamins. Of course, those are going to be prescribed now. Any instructions he wants her to have, but here's those referrals right here that you can generate. So
and that is usually picked up with the EPM at checkout.
Okay. So is who is going to be generating this information for the patient?
Yeah, that will be the front desk, the checkout.
Okay, so they're going to have to be trained on how to get into their electronic health record, right?
Right. Mhm.
Okay. So their main purpose is only really going to be checkout then. And they'll come in here and they'll see, okay, the doctor ordered this medication. And this is actually a really nice template because down at the bottom, we're going to say, okay, patient understands 2 medications are started. They've got 2 office services. They've got 2 referrals. Okay, so everything was done. Then we can actually print a checkout note for them.
Right.
In addition to giving them their actual referrals. I think this one says, thank you for choosing us for your healthcare needs, or is it the other one? Oh, that's just an orders. I like the other one better. This one is kind of like, if I got that from a doctor, I think I'd be like, okay. Let me go back to my checkout here. And let's print the other one, the one that says patient. Oh, we printed it, dear. Sorry? This is the one I like. It's your choice, though. Yep, thank you for choosing us for your healthcare needs. It just basically puts everything on there, their meds. It's just a little synopsis, the referrals that we ordered. All right. And then again, you'd still have to, go in and if you need to print out the requisitions. I don't know how you're going to do those, but you can just highlight the line, click referral, then go to the other one, and then click referral. The unfortunate thing right now is these are going to override each other, the actual document, but the order is in there.
Okay.
So you'll see. So there's the one to assume care for this high-risk pregnancy. Okay. So, yep. So they'll just have to be trained on, how to use this template. And then the actual process after we've verified and done everything, if we go, next is going to take us to protocols. Of course, then in EPM they would check them out. So really, really nice template. I'm really excited over a lot of the templates they've created. Did you want to go over the postpartum and the pregnancy outcome tomorrow, or do you want to do them now?
Postpartum. Yeah, we can go over them tomorrow.
Okay, I'll just give you a quick look. They're they're very simple. It's just what was the outcome? Postpartum visit. So, and then you can actually get right to pregnancy outcome right from here as well. You can do, you can do both at the same time. And look what it opens up here for you. This is just a different view.
This is for after pregnancy.
Delivery. Yeah, because anything we fill out here is going to update her past medical history.
Right.
So, if she's pregnant again, the last, as long as this template is utilized, then all her histories are going to be in there. So it's really nice because look at the bottom. There's the grid of everything I've already built.
Okay.
And there's all her pregnancies right there.
Very good.
Yeah. So they're nice. They're just, they're a lot different looking than the intake OB.
And
but they
it takes
share.
some getting used to. I guess you just have to practice.
Yeah. Now, could any of these patients that are coming to you for OBGYN be going to the family practice clinic too?
Definitely.
All right. So, and you're an enterprise chart. So guess what? If they go to the family practice suite first because they've got a sore throat and something else going on, and they chart all their meds, and they put all their histories in, and they put all this stuff, when you get that patient, 85% of the stuff's already in there.
Oh, okay.
So that makes it nice. So it's what we refer to as an enterprise chart. So
Okay.
that your doctors can see what the family practice has been doing, what meds your patient is on, what the histories are, and then vice versa. When they go back over the family practice for something, they're
They
going
can
to
see what this doctor's been doing with them
Exactly.
also.
Exactly.
But will that apply also for clients that need to get medical clearance? The doctor sends them to the medical doctor for clearance to do a hysterectomy or surgery.
Yep.
They can
If
see
they're all part of your
each
enterprise.
other's charts. Okay.
Really nice. So let me show you one last thing before I let you go. I mentioned earlier, like for your recalls and missed appointments, another, whoever is going to be documenting the missed appointment can add this additional template into their tic-tac-toe grid here of their preferred. If I just toggle over to all, I believe it's actually called missed appointment, and there it is right there.
Okay.
So it's a nice little template because, especially for your OB patients. Again, let me get rid of history here again. So we could say just where they cancel a no-show. So if we say they no-showed for their appointment was, say, at, like 2, we'll say at 2 o'clock, all right, and that was in the PM. And the type of visit would be their, like, OB prenatal, all right, who they were supposed to be seeing. It pulls in their demographic information, and then any little comments, patient has no-showed for last 2 visits. You just add a little comment on there if you need to, or just, to this. But the important thing here is to save it, because it starts to build a history, okay? Then they can take action. Okay, so after they've documented it was a no-show, they come into this action field. What happens then? They called the patient to reschedule. They left a message. No action necessary. They are going to send a letter to the patient to reschedule. Maybe at this point they need to send a certified letter. So it lets you take proactive steps toward managing your patient's care. So maybe we called and rescheduled the appointment, and then we submit this. And that's what fires it down here to the grid. So this is going to keep a running tally of all your patients' missed appointments. So if you start running into noncompliance issues, especially with your patients that are pregnant, this could be valuable. And then at the same time, if they're no-showing, maybe you need to task this to the doctor to say, hey, look, your patient hasn't showed up for their last 3 visits. What do we need to do? And the doctor could task back and maybe send, I'll try and call them, whatever proactive steps you want to take, to document that. And then, of course, then you could come right after it's done here. I could fire, right to the document library, and I could generate that missed appointment reminder. And print it and mail it to the patient. So, really, really nice. Mary test has been bad. So, good little template to use. Okay? Now that your brain is swelling, probably not as much as it was swelling last week with Leanne, though, right? But I talked to her over the weekend. She said, "Oh, you're doing specialty training for a client I did core group through this week." I'm like, "Oh, cool! So they're already gonna know everything they're doing." So, but is there anything else you want to see?
Let me see if I can quickly grab that with Hoffman's attention and see if there's anything else you want.
Okay. Now, I see your only OB?
No, we actually have 3 providers.
Oh, okay. I'll apologize. My dog is under my desk in case he starts barking.
No problem.
Just like thundering.
Today's assessment. And for the telephone call, the telephone call task.
Okay.
Can I use that from navigation up here, where it is on the top
You mean
of
just
navigation?
document telephone call?
Yeah.
If I say if there's a telephone call that happens the same day as an office visit that you have to call the patient, then yes, fire right into that little telephone icon to open up the telephone call template.
Okay.
Okay, and then go ahead and, maybe you're calling the patient back, you're doing an outgoing call, for a specific reason. Maybe you need to talk about, the call reason. You have a little pick list in here. Answer to a medical question. Then, of course, you can free text in here. If it's not the same day as an appointment, then I would create an encounter and then pull in the telephone call and document, because you want your documentation to reflect, the current date and time. But absolutely, if it's the day of the appointment, use the telephone call embedded within here. If it's 2 days later after this visit, okay, and you're going to call me, all right, what you're going to do is you're going to open up my electronic health record. You're going to look at my history, and you'll see this is when I was in, hypothetically, the other day. You're going to create a new encounter. All right, so we have the encounter that fires in another one for today. Then you'll pull in the telephone call template, because you don't have to put a visit type or anything in it, because it's a telephone call, and it's a non-billable charge. Does that make sense?
Yeah.
Okay.
Thank you.
That's just me. I'm like anal, but that's
Test
how you
result
do it.
request, select, outgoing calls. Okay.
And you would use this like if your patient was calling in, need a medication refill, if they had just had a question, if they wanted a test result, they need a referral, all different types. And it's got the nice grids with the medications, their allergies, and all their protocols, which is awesome, because if you're on the phone and you see the patient is 2 years overdue, you can say, hey, Mary Tess, do you know that you're like 2 years overdue on all these tests? Get them scheduled to get them done.
All right, I can't really think of anything else right now.
Okay, you'll think of more things. So,
Subjective,
all right, so
the soap.
doctor doesn't do anything?
No, he didn't come out the room like that.
Oh, okay.
No.
All right, well, just make a little list if you think of anything.
Yeah, if we have any
Tomorrow,
questions, I'll jot
yeah,
it down.
we'll go over.
I have to confirm with Val that we're doing it at 9, you said, tomorrow? Because I know we have a meeting, standard meeting.
What time's your meeting?
Meeting starts at 8, finishes at about 10.
Okay. Just,
Yeah,
I'll just start the WebEx and you jump on when you get on.
Okay, not a problem.
Okay, how's
I'll
that
let Val know. All right, thank you very much.
Okay, thank you. Yeah, thank you, Susan. Yeah. Okay, no problem. Yeah. Okay. You have really